Hello everyone. We are doing a series of um, recordings with Dr. Madan while he's here in Australia. So we will continue the series, and today we will talk a little bit about dysmenorrhea and management of it with homeopathic medicines. I'm Dr. Asha Kiran, and this is Dr. Madan from Bangalore, and he is practices at the legendary Ashwini Clinic, and he is the professor of surgery at Bhagwan Buddha Homeopathic Medical College, and he is also the professor emeritus at the Rajiv Gandhi Health University, Bangalore. So it's an important topic, something that a lot of women go through, young and also those who are going towards menopause. And the perimenopausal can be quite painful, or even with people with PCOS can have a lot of painful um, uh, menses. So let's talk a little bit about that and how we can manage it with Dr. Madan. Sir?
Thank you, Dr. Asha. First, I want to say the dysmenorrhea itself is not natural. Usually, they think it's common, every lady will be having, so it is natural. This menses is a natural process. Menses is not a disease. Even complaints after menopause is not normal because menopause is not a disease. They are all the events in the life cycle. Even the complaints during menses is an indication of deviation of health from the normal. Nature has not provided us any discomfort during any of its process. We have 20 feet intestine inside our abdomen which moves 3 to 4 times per minute. When we get the pain, we know that there is indigestion or some other problem. Our heart is beating 60 to 80 per minute. When there is a deviation, immediately we feel either the palpitation, pain, everything. Same way, the menstrual cycle, like urine and motion, that is another excretion. As there are no discomfort during urine and motion, there should not be any discomfort during menses also. So in dysmenorrhea, usually even homeopaths, they write dysmenorrhea. The mere word dysmenorrhea gives us no clue for the selection of our medicine. We have to ask what actually the suffering, whether there is abdomen pain, whether there is back pain, or the pain is extending to the thighs or only present in abdomen or present in back, or the pain is extending from back to abdomen. Why even that? The pain is extending directly from the back to abdomen or around the abdominal wall, or sometimes even the pain, whether it is abdomen pain or back pain, is it continuous or intermittent? If it is intermittent, whether the pain is present before the discharge, during the discharge, or after the discharge. If the pain is continuous, whether the patient is better by bending double or stretching their leg. Depending on these things, the medicine differs. When there is more of abdomen pain, we have seen Scipia has got indicated, Colocynth got indicated, Plumbum got indicated, Bryonia got indicated. Depending on the modality, we select the different medicine. With the backache, we are seeing the Calicarb, the Viburnum, the Helonius, and Ferrum metallicum. And when the pain is extending towards the thigh, we also have seen the colophyllum has corrected the dysmenorrhea. So depending on the symptoms, the medicine will differ. If the pain is extending from back directly to the abdomen, is helonius. If along the abdomen pain, if it extends, then it goes with the viburnum. If the pain is continuous, it is sepia, and better bending double is colocynth, better stretching their legs is diascoria. If the pain is intermittent, there is a pain before the menses, before the discharge, and when the discharge appears, the pain comes down is nux. When during the discharge, particularly when while passing the clots, if there is pain, then it goes with simicifuga. If the pain is after the discharge, we have seen it goes with many times with lachesis. And when the type of discharge, many times when with this, if there is excess discharge with bright red, we have seen Sabina has helped. With the dark stringy red, Crocus sativa has helped. With dark red, Lachesis, Vipera, and even the Hemamelis. When without pain, when there is a bright red discharge, Millefolium, and even when there is a pain during the discharge because of the movement, we have seen Bryonia has helped. And with this, with the backache, we have seen Calicarb, as I told you already. So whether the bending double modality like bending double or stretching, we have seen colocynth and diascoria has helped. And if it is extending from back to the thighs, the drug like colophyllum has helped. So these details, these are only the examples to show how we have to treat the dysmenorrhea cases. Just if you write dysmenorrhea, you don't get any clue for the selection of our medicine. So while taking the history, you must take what kind of pain they are having, what kind of discomfort they are having. These details will give the clue for the selection of our medicine. Same way, whether there is any premenstrual conditions like breast pain, because many doesn't know that there should not be breast pain before the menses, because all these deviations or the sufferings gives the clue that their hormone system is gradually deviating, imbalancing, which may lead to endometriosis or increased endometrium, or leading to fibroid, or leading to ovarian cyst. So of late we are seeing even these the ovarian cyst cases are increasing. That is because what we have observed is the salt which contains iodine, excess intake of iodine, is also one of the causes of thyroid problem. In many cases, though it has not brought about the thyroid problem, definitely it has brought about the hormone system, and the electromagnetic rays of cell phone radiations which is affecting the pituitary is also responsible for the appearance of PCOD. On this basis, after treating the patient with pituitrinum and even bovista, which has the affinity towards the ovarian cyst, we are seeing the PCOD cases are coming around.
So we have covered pain. Dysmenorrhea, obviously it's pain. We have covered a little bit of the modalities. Can we now think about what kind of you have also covered the nature of the flow, which is the color, but can we also nature of the flow, can we talk a little bit about it?
Yes, nature of the flow. See, very bright red we have seen calcarea, carb, and belladonna.
Yeah.
Belladonna in acute and calcarea carb in courses has that
Or
nature
as-
has come down.
As a follow-up, maybe.
Yes.
Hmm.
The dark red, very dark red and blackish red and stringy, the lachesis and the crocus sativa has helped. In one case of excess metrorrhagia, where the patient was staying in Dubai and was not getting leave for her work and the discharge were very high. After hearing that her complaint and the nature of discharge, which was very dark, blackish red and slightly with clotted and stringy. So I thought that the crocus sativa should help. That's why I keep telling my assistant doctors to know from which material it is made, because we have the raw materials many times with us which can be converted to the potency. So I brought the crocus sativa, that is the saffron petals, squeeze few petals in a small amount of water, added 1 drop of that water in half liter of water and to shake it well for half a minute and asked her to keep taking 1 sip every 15 minutes because it was very severe. The discharge, which was very severe for the past 2 days, just stopped in half a day. She was very happy and her discomforts also has come down. And after that, in her next menses, she had mentioned that there was no metrorrhagia. The discharge was normal. So the medicine which was selected on the type of discharge, if there is a very bright discharge and very dark clots, you can think of Sabina. If there is a blackish discharge and the bigger clots, even your Eustilago will help. Along with that Eustilago, since it being a fungus, we have seen where because of the excess discharge and wetness around the genitals, many have developed the candidiasis. So the candidiasis could be corrected with Eustilago because it is also a fungus which has candidiasis is also a fungus which could be corrected, rather it brings the resistance to the fungus by fungus itself. As you know, if of course of late there is a excess discharge after the vaccination side effect, we are seeing the tellurium, the trillium has brought about the discharges, bring down the discharge which was very bright red and flushing discharge leading to many times anemia. With prolonged discharge and when there is anemia, we are seeing the alatris farinosa, which also corrects the anemia as well as stops the discharge.
There are some medicines which act, the modalities are in the morning or afternoon or night. Is there anything specific we have to consider, sir?
Usually the night discharge, we have seen the MAC carb has helped. Magnesia group has the discharge more during the night
times. Yeah.
So on that basis we have seen. And even during day, if it is very severe and where there is more of vomiting sensation, even Ipecac has brought down the discharges during day. Usually because of the movement, the discharge will be more. So Bryonia, Trillium, the Sabina, these things have brought down the discharge during day. Invariably, the night discharge brought about by the magnesium group, and when the discharge is very watery, we usually give alumina. Alumina has the watery discharge, more of watery discharge.
Okay. Not that thick clots kind of.
Not clots, and you will find more of watery.
So I think what we are learning from this is that we have to characterize every condition, and we can't just broadly take and prescribe for any of that. So what we have discussed is pathological characterization. Your patient may need
different medicine.
Further individualization, that's up to.
This is only an example that to how to handle such cases. The whatever the medicines told may not be an absolute medicine for you, the case before you, but if you select these medicines, rather if you learn to pick up the medicines in this way, or rather the approach the case in this way, your prescription, it will be easy for you to go to a particular medicine.
Again, I think if we don't treat dysmenorrhea,
it leads
if we keep managing it with painkillers for a prolonged period of time and not reverse it back to how it was before. Sir, you want to talk about it?
See, once again, dysmenorrhea is a cry by the nature to indicate the external world that its function is getting deviated from the normal. If that is allowed by suppressives, suppose when there is a pain, you take the painkillers or antispasmodics, which suppresses for that time, and but the factor responsible for that will be still there in the body, still keep on deviating the nature, and which leads to ovarian cyst or fibroid tumor, because these things will not come overnight. The nature gives an indication very early that it is deviating. We homeopaths, if you don't understand and correct it, they lead to the pathological conditions.
Again, when let's say the person has had the problems, dysmenorrhea, but she's now into menopause and no longer has dysmenorrhea. Now again, it's you can't just overlook the fact that you had these problems. It's still very relevant because you already had a hormonal imbalance, which can continue without dysmenorrhea. And so you want to talk about it?
Yeah, even when the patient come after menopause, don't just neglect that it is already there is menopause. We need not take the details of their earlier menstrual cycles. Many times we have seen in most of the cases that itself has given the clue to select their constitution medicine, as well as the select the medicine for their present complaint also, because the way they had suffered during menses gives the clue for the select of present medicine also, the day that they have visited you.
So just a caveat, even if the patient doesn't come to you with menopausal symptoms, that doesn't mean there are no changes, tissue changes taking place in the uterus. So it's very important. There can be just thickening of the lining of the uterus, which can lead to uterine cancer much later. So no matter what, if the patient has had dysmenorrhea and has not been corrected with homeopathic remedies, it's a good idea, whether she has symptoms or not of currently, good idea too.
As you said, prevention is better than cure. Many times this gives the clue for their to select their medicine and prevent them for progressing into some dangerous problems.
Have we covered everything, sir, with dysmenorrhea? I think we have,
Yes.
isn't it? Thank you very much. I hope you enjoy it. And if you have any comments for about this or whatever you need to tell us, leave that in the comments and we will take your feedback and we'll do more of these. Thank you very much.
Thank you. Thank you very much.